Okay, we started recording the session, so anyone who cannot be active on the Hangout can then look at YouTube at what we're recording now. Only 8 students can actually be active. Okay? Yeah. Let's go.
Okay, so we have the PowerPoint.
Yes, we will be sharing it.
Share. Okay, so we're going to have the PowerPoint. It's a very short presentation. Most of the stuff we wanted to be able to field your questions. Most because I know that there are a lot of questions that are hanging out, and also because because we want to communicate before the deadline for ARIS, and also the office is going to be closed here for a couple of days, and so we want to make sure that everyone gets online there. Can you guys see the PowerPoint? I don't know how that works exactly, but anyone else online here? Mark Daniel.
Okay.
I don't know if anyone's listening. Here, now I see it. Yep. Yep. Okay, no more. Yep. No. No, but the first slide. Yeah, just the first slide. Just start. Okay, that's fine. So okay, I can't really hear this, but can you make the full screen? Yeah. So I can see the. Still can't see it. I don't know if it's supposed to do something different. And there, guys. Yeah, that's it. You guys want to hear about lung cancer or residency? Kind of weird. I don't even know if anyone's listening. Okay, here we go. Can you just check if someone's listening, or you don't know?
We know that it's streaming live. And it's just
okay, now we have the PowerPoint. Okay, so September 1st, I'm not sure what that was supposed to be, but as you all know, September 15th, so that's the ARIS downloading day. I know from the questions that we've received, both in the office and also that most of you have gotten deep into this. I obviously just want to encourage everybody to make sure that they have all their ducks in a row, not to wait until the last minute. I think Tommy sent you an email about that, but there was a crash last year. If there are any problems, we want to get this all out of the way well ahead of time. As far as the October 1st, and we'll come back to these details in a second, and then we'll take also your questions, and we'll answer the things that people wrote in. October 1st, in terms of the dean's letters are basically finished, and Barbara is touching them up, and they'll be ready to release on October 1st as they should be. NRMP, I think we don't have a lot of questions on that specifically. Everyone has basically signed up, and at this point in time, that's not really the main thrust of what you're going to be doing right now. We're going to talk about a couple of things. One of the things people have said is, how many programs should I apply to if I'm applying to multiple specialties, things like that. So, what should I do? How many is the right number for me? And it's a little bit of a complicated answer. Obviously, everyone's individual. We will talk about this. Prelims, letters of recommendation. And I do want to mention something about personal statements. I would say that except for the people that sent me a personal statement in the last 2 or 3 days. Okay, I'm sorry. Send me their personal statement like that in terms of feedback. Okay. Someone can holler if this is working out well if you're hearing this, but okay, we know that it's working. Okay, so this slide is taken from NRMP data. I hope you can see this. It gives a sense of some data in terms of applications, interviews, etc. So you can see that the difference is here for matched US MDs and matched IMG. So for example, we'll take the top line, anesthesiology. So people that applied to 30 programs, they got 15 interviews, and they ultimately ended up matching. I think at an earlier meeting, we talked about the fact that you needed somewhere between 8 and 15 interviews in most specialties to be considered of a match. I think it is more competitive, like one of the surgical subspecialties, then you need a little bit more than that. So let's talk about something that's like very common for a lot of people. You could see that for internal medicine, IMGs, and this is all comers, they applied on the average to 94 programs and they got 9 interviews. So from that, you could take that if you're applying in internal medicine, since there are many more programs, you should be applying to somewhere in the vicinity of 90 programs. I'm not sure that that's true for everyone. Those of you, and we've talked about this, that are more competitive, you probably can be fine with somewhere between 40 and 50 programs. And that will lead you to hopefully around 10 or plus interviews. That would be the goal. If we go down to pediatrics, for example, the numbers are a little bit smaller. That 50 programs for IMGs allowed 10 interviews, and ultimately those people matched. So I think for most peds people, I think that between 35 and 40, that's the right number. Some of you are a little bit less competitive. You need a little bit more. Certainly, those people that are applying for things that are super competitive, whether it's surgery where you see it's like 77 and 4, or emergency medicine where it's 40 and 8, all of those fields now in 2013 when it was less competitive, you need to apply to a record number of programs. Obviously, this is a very large number, but it also means that it's not just applying to Duke and Harvard and NYU. It's really a mix of programs. Typically, what we recommended is that people choose a mix of programs. So it's maybe 20% of programs that you're really reaching for, and then the bulk of programs that you think that you have a shot based on things that we've talked about in terms of your scores and your record and stuff, and then at least another 25 to 30% of programs that you probably don't necessarily feel are your top programs, but you want to get interviews because without a good number of interviews, just the risk of not matching. So I can look at this data. There's data like this online for all different years. But again, it's an individual issue. If you're applying for super competitive something, then you need to apply to more programs. If you're applying for something like peds or something that's a little bit less, like family medicine, you may not need as many programs again. But it depends also on geographics. If you're flexible geographically and flexible program-wise, then you may need to apply to less programs. Okay, this is the slide that you've seen. We said this already. Just don't be late. Just to reinforce that. There's really no reason for anyone to miss the date. Now, someone wrote in, I think, one of the questions that we got is, what should we be doing on that day, on the 15th of September? Should we be, at 9 o'clock? Should we be having coffee? Should we be doing something specific? Okay.
We need to share screen. So
They're not having it up until now? Yeah. Okay, I guess up until now, people haven't been able to see the PowerPoint. So I'm just going to show you briefly. This is what we saw before with the numbers. This is just data from NRMP, the NRMP data, and you can go look that up online. This shows you the number of interviews for applications versus interviews versus matches, IMG and US. So you can take a look at that later, be available. So please don't be late with your LRS application. I know you've seen this before, but it's just some people say, well, I just have one more detail. I'm almost there, or whatever. If your application is not complete, and we'll talk about what that means, basically is everything except for your 4 lores. So if you have 1 lore that you're waiting for it to come in, your application will still be considered complete. Now, for those of you that have talked with the office about stuff, we've uploaded all of your stuff, all the things that you've sent to the office is all on there. And so she'll be all set, your transcript and all the things, and then of course October 1st Dean's letters. But it's all there for you. So really the things that you have to do in terms of your sketch and your personal statement and things like that, that's what you have to do that, and you have to take care of that, and you just want to do that, make sure that you do that on time. Okay, we talked about this. Now, I'm just going to remind you, this is not the main focus of this presentation, but we have seen that most of you are really doing amazingly well. We've gotten people have gotten some really beautiful letters, some strong letters. Other people, let's say some okay letters. We'll talk about that in a second. There are still a couple of people that are coming late, are not prepared, and it's really that's the biggest way of shooting yourself in the foot. I can't emphasize this more, that nothing is more important than your performance on your rotation. So if it's an important rotation, if it's your key rotation, if it's not your key rotation, you need to really be on top of things. That's just a side note. I'm going to skip this. Why is this not? Okay. So in terms of letters of recommendation, you all know by now that you needed 4 letters. Now this 4 letters, as you've seen in ARIS, is basically for each type of program that you're applying to. You can do different letters for different programs. Someone asked me if there's a hospital they really, really want to work at. Can they write a specific personal statement? Can they really try to focus? Their letters that that one spot gets the right letters. You can really do whatever you want, but I think for the most part you should be using most of the same letters. The letters that are good, even if they're not necessarily specifically directed to your field. The issue of prelims, basically you just want to be using the same letters for a prelim. You don't want to be like focusing specifically on internal medicine. If your letters and radiology just by Wednesday of this week, but you should have gotten a rating for your letters. Now, some of you have written in and said, listen, you rated this letter, good or very good. Can you give me some more information? Can you let me know if it's short, if it's long, if it's fat, if it's thin? There's just no way of remembering all of those letters. I don't want to lead you down the path, and I really can't get into the content of the letters. So we've tried to rate them as best as possible, and you just have to go with that. It's more information than really technically you're supposed to have, but that's the best that we can do at this point. Specifics of the letters. If we tell you something is not to be used, there's a reason for that, and so just be sensitive to that. The PTAL, you've gotten a letter from the office that you don't need to use one of your spots for the PTAL, those of you that are applying to California. I just remind you of confidentiality of letters of recommendation. You're not allowed to read the letters. You're not to know anything about the letters if by chance you happen to have seen one of the letters. So just be aware that you're not supposed to reveal the contents of that letter, and just be very careful about that. That could get you into really deep trouble. Okay. Now, one second, I'm going to go back before we start about letters. Some of you have questions about this in terms of you're trying to figure out what letters to use. Again, you really just need to use your strongest letters. You can use a surgery letter even if you're applying to OBGYN, but you do need to have a baseline letter in your specialty. That's important, and most of you have gotten that. If you haven't gotten U.S. letters, if you haven't managed to get that yet, you need to work hard on getting those in as soon as possible. What happens if you're about to get a letter in the next couple of weeks, and it's September 15th is coming up, so you can save a spot and add the lore afterwards, okay? Even if it's a month from now, you can still add an extra lore. I wouldn't add 2 lores. I would only give 2. I wouldn't just use 2. I would go with at least 3 for the download date, especially in fields like medicine and pediatrics where they download right away. But you have to just be careful about this. Okay. So, we talked about the personal statement. I feel, Dr. Kaplan and I think talked about this. Some of you have written amazing personal statements, and there are some people in the class that have just done a tremendous job with this. They worked really hard on it, and they add so much to your file. Other of you have, just kind of waited to the last minute, and it shows. And I think that there's still too much, and I don't know how much more I can go through them before the deadline, but there's still people that are talking about why they love surgery. I am going to be an excellent surgical resident because in surgery you have a mix of technical ability and talking to patients. And here's a patient that I saw during my surgical rotation. Really, really not what you need to be writing. You need to really talk about yourself, about your experiences. People have talked about all kinds of things, sporting events that they've been a part of, volunteer stuff that they've done, even connection with family members. You need to make it about yourself. It needs to be no longer than one page. There's no excuses about that. Anything longer than one page goes in the trash at many program directors' desks. You need to really edit it. It can't have any typos, any sort of colloquial phrases. And I'd like to talk to you today about myself. Be careful about the word I. Be very careful about the word I. I did this. I did that. I did this. Then I was that. And then when I decided to do this, I know we've talked about it, but it seems like a lot of you still have made a lot of these errors. And so I just encourage you to look through it, and I'll try to get as many as I can this week before the holidays. Any of those edits. Now, here's another thing. I know that some of you probably are a little bit frustrated with the edits that you've gotten. You've gotten some short comments or some comments like "this is not ready for prime time." Please, those edits are for your benefit. I'm not giving you those edits because I'm trying to save time or to not look at your personal statement. There are just some areas that are really, really not. They're red flags. A personal statement that doesn't read well is a red flag. Most program directors will say that when they look at a personal statement and it just doesn't hold together well, it's a red flag. You don't need that. You want to be putting your best foot forward. So when I'm telling you those things, it's just out of reading a lot of them. Please take them seriously. Don't be offended. I'm not trying to personally offend you by giving you comments on your personal statement. I just want it to be really good. And some of you that have worked on it, that have really turned out amazing personal statements, it's really worth its weight in gold. So please keep working on them. This is what I just said. Let's see. Oh, people have asked me about personal statements for prelims. The truth is that it doesn't need to be super different. The prelim programs know that you're not going into their field. So, if you have a good personal statement that talks about your desire for emergency medicine, you don't need to pretend that you're really going home about internal medicine. Emergency medicine is your field, and you should just go for it. Your personal statement, if it's good, it's good. It doesn't really matter what the prelim is. So that's what my advice in terms of personal statements for prelims. That's a little bit different than if you're applying for two different specialties. If you have an OB/GYN directed personal statement, you're also very much applying for medicine, needs a backup or an alternative or something else, then you need to tweak the personal statement. Some of you have done that really nicely. But the key elements, the key stories that have happened to you, the key experiences, those should be much the same. The good stories are the good stories. Don't save them for a different statement that you're not going to use. Okay. As far as prelims, I've said this before, please don't take this lightly. If you're applying for an advanced field, it starts with year 2, radiology, some anesthesia programs, ophthalmology, all these things that need a prelim year, you need to have that prelim. Now, if you end up without the prelim and you match in your advanced field, and you don't end up getting a prelim in the match, you're going to end up in the SOAP, which is super stressful because if you don't get a prelim then you're out and you lose your categorical
Hi, everyone. We're having some technical difficulties. Just hang tight. We'll be with you again soon, hopefully. Still can't hear you, Dr. Allen.
Hello? Can you hear me now?
Hi, now we can hear you.
Okay, so, yeah, you can hear me now. Okay, so let's go back to the PowerPoint. Yeah, go ahead. Okay, where do we stop? Let's see. Yeah, here it is, right here. Okay, now you can hear me? No.
Yep, we can hear you.
Okay, I just hold the microphone close to my face. Okay, where were we in terms of the, where were we on the, yeah, hi, guys. Okay, where were we in the presentation?
Can you show us the PowerPoint? We can help remind.
Are we on the PowerPoint? They can't see the PowerPoint.
רגע, זה הסלייד שאתה רוצה?
Yeah, בוא נגיד. Okay. There's delay.
delay של ה-voice? אוקיי, ועכשיו אמורים לראות את זה. תשאל אותו אם הוא רואה את ה-personal.
Can you see now the PowerPoint?
Yep, we can see it.
אוקיי, יופי.
Where are we up to?
You were discussing that if someone doesn't match into a prelim spot, that they'll lose their categorical position.
Okay. So I'm going to continue from the prelims. There might be a little bit of a delay here, but basically, we don't want you to take the prelims lightly. You need to find the prelims. They can be sometimes very competitive. They can really be in any field. So you can do a prelim in medicine. You can do it in pediatrics. You can do it in OBGYN. You can do it in transitional year. You can really, you can do it really in So the other thing I said is that so if you're applying in a field where you also are applying for the categorical spot, so your prelim and categorical spot in the same field. So let's say I wanted to match into general surgery. Should I apply at the same program that I am also applying for a categorical? And the answer to that question is basically that if you're applying for both, they're really only going to consider you for a prelim. So unless this is like the program that you want to be at, and you're willing to go there for prelim over categorical, you need to choose different places to apply for prelim and for categorical. So that goes also for, like, let's say OBGYN, where there are some prelim places, and you just need to know how competitive you are and whether you're applying for both of those. If, however, let's say for radiology, and you're also applying for prelim, medicine, or surgery, that's fine, because they obviously know that you're applying for 2 different specialties, so that's not a big deal. Okay, so that's the issue of prelims. Now, we're going to talk about backup plans. So most of you should have backup plans to some extent. And those of you that don't have backup plans, because I told you specifically that you don't need a backup plan, whether you're in, let's say, peds or in medicine, where you're competitive, you don't need a backup plan, but everyone else should have a backup plan. Now, you need to be able to know to switch to your backup plan very quickly. So it could be that what's going to happen is you're going to see in the next 6 weeks, by the end of October, hey, look, I don't have anything. I'm not really getting any bites for interviews. Then you need to make a switch. Or else you'll decide to make a switch because something will happen that will indicate that you don't want what you were doing. You realize, I don't want anesthesia, I really want radiology, or whatever it is. If you make the big switch like that, or you need to make a big switch, please consult with us. Load the boat. Don't do this on your own. This can be successful if you need to do this, but it requires some finagling and some finesse. So please let us know where you're holding with that. Don't disappear. So I next get to something about personal issues. Every year this happens. It could be someone has something amazing happen to them. They find their soulmate, and they want to get married, and they kind of lose track of the rest of the year. It could be someone in the family gets very sick. It could be that you yourself, God forbid, get sick. It could be any number of things. It occurs, and it's okay that something can happen even in your 4th year. But the 4th year is really tightly scheduled. So if you end up having something which is causing you to wipe out, as you can see in the picture, you need to let us know, because there isn't a lot of finesse here. All you need to do is disappear for 3 or 4 weeks, and that's enough to really trash the rest of the year. And it could be something innocuous. It could be that someone something happens, and someone thought they were. It's happened a couple of times where one of the students thought they were pregnant, and they weren't pregnant. They were pregnant. All kinds of different things that could happen, and it's fine. It's not natural. It's part of life. But we need to just know, so we can help you and negotiate this and make the decisions. Okay, so
Just
that.
see that they can see the slides. אוקיי, אז באיזה סלייד אתה? אוקיי. אוקיי.
Okay.
Weeks of absence, you have to tell us why.
Okay, so that's really the formal what I wanted to present. I want to now go over some of the questions that people have had. Some of these technical questions, things of the nature of, is it better to put things in a bullet form or a paragraph form? We really can't have, but it's not. I don't know if there's really an answer to that, and I also don't necessarily know, if we're going to have time to get into that. We talked about personal statements for transitional preliminary year positions. I think that was covered. People ask, should research activities completed more than 10 years ago be included in the application from undergrad? The answer to that is really they should be included in the CV form, but they shouldn't be detailed, be discussed. 10 years ago is really not relevant, other than how it affects the number of publications that you overall have on your record. If there's research that you're writing an article about the time ARIS opens, but it's not submitted yet, can you put it on the application? Of course, you can put it in either in being submitted, or you can just put it in and then put it in the text in parentheses and just say, in progress or something like that. As long as you're honest about it, I think it's fine. Let's see. It says, can we have clarification on how to approach single-year internships, especially as radiology, accept any transition? I think I answered that. Yes, you can do anything you want. It doesn't really matter. It also doesn't, some in terms of selecting those programs, a lot of times people like to do something which is less rigorous. because they don't want you to kill themselves for that year, because it's a year that otherwise is not really important for the rest of their career. If the information about biography is in the MSP, etc., should this even be not repeated in a personal statement? So that question basically admits to not understanding the personal statement. The personal statement is supposed to be presented in an appealing way. It could include elements of the biography. If it's something very important that you've done, you volunteered for a year in Peru or whatever it is, but in a narrative format, not in a, and then I did this, and then I did that, and then I did this, and then I did that. The personal statement is an interesting piece. It's supposed to be grabbing to the reader's attention. It doesn't matter if you've mentioned it or you haven't mentioned it. It's preferable to mention things that maybe aren't in the CV, but it doesn't have to be. It can be something in the CV. U.S. electives in the work experience section, no. Okay, that's not supposed to be in the work experience section. It's not considered a work experience. If your USMLE transcript is authorized, that's it. You don't have to do anything else. If you have oral presentation and a poster at the same conference on the same research, I wouldn't list those separately. It's one issue. Can you use a lore from a clerkship that's different than the residency you're applying to? Sure. If you're like your baseline Sackler letter in peds or medicine, you can certainly use that depending on what you're applying to. If it's a good letter, it's a good letter, it's a good letter. Let's see. We talked about the number of programs to apply to. We talked about the timeline for September 15th. There's not specifically anything to do. You just want all your stuff to be in by before September 15th. It's not that you upload on September 15th. By September 15th, you want it to already be uploaded. Can we leave reasons for leaving blank? I don't know what that means. Okay, we're going to skip that. Honors and clerkships, I don't know if that's awards, but outstanding student certainly is an award. Other awards that you've had. How late can we post recommendation letters from U.S. electives? I would say up until a month after the ERA's September 15th date. Should all U.S. letters be used, even if there's not from Israeli clerkships? Not necessarily. I mean, there's a couple of U.S. letters that we've seen that are really not that strong, that really are just a paragraph long, and that are not really worth investing time in. Some of those are really good. So, any other, if everyone online or not online wants to send in questions, wants to email, wants to, on the Hangouts, post something, we'll be happy to take some questions.
On YouTube.
On YouTube. Daniel said, reason for leaving is listed on all experiences as a blank field. I don't know that I understand that question. Can you clarify the question? The question, I believe, is does that need to be filled in? I still don't understand what we're talking about.
When they finish the clinical experience?
I don't know. Yeah, you can just talk over if someone has a question. You can just speak up.
Hi, Dr. Allen. So within the experiences section, when a person is filling out ERAS, there's multiple fields that we have to fill in. So one of the fields is reason for leaving. So there's description, and then there's reason for leaving. And so within a lot of experiences, it might be self-evident why the person might have left that that experience. So we just wanted to know whether or not a person needs to enter in for every single experience why they left, or whether it's appropriate to leave it if it's self-explanatory.
Right, you can just leave it. You don't need to say anything.
What's the question?
Usually it's delay.
There was another question that was listed about publications within the authors, whether an ampersand needs to be included in between every single person. The formatting wasn't exactly clear on the ERAS section, so I think somebody just wanted clarification whether or not they just put a period comma in between every author or whether there should be an ampersand.
Daniel?
Yes, Tammy.
Just a second.
Now we can't hear anything. Still can't hear anything, Dr. Allen. Still nothing.
Okay. פשוט לבוא.
Now, yeah, now we can hear.
Daniel? Yeah. He's
Yep.
reconnecting. Just a second.
Okay, we can hear.
Okay. Here we go.
Okay, good.
Can you hear now?
Yeah, that's fine. Okay, so what else can we do for you guys? What else?
There's another question if there was a significant lag time between when the office receives letters, when they upload them, and when they appear on Oasis, and how we should communicate with the office about it.
Okay, I'm going to ask Tommy because you said that everything has been uploaded. I don't know if there's a lag time or not. I'll have to check. We're going to check with Tommy right in a second. Anything else?
I think there's a little bit of confusion about the U.S. electives. I think previously we had been told to include those as work experiences within ERAS, and so is that something we're being told differently at this point?
I mean, I'm not sure what that teaching was. I mean, it's not really a work experience. Work experience is work. I mean, you know, your U.S. electives are going to be are on file. I don't know why that.
Do they show up within our transcript? Where else would they show up on ERAS? Because we don't see them specifically.
Their electives, U.S. electives as work experiences?
Yes, that's what Eric said.
Oh, sorry, my bad. So Eris actually, this is what Tommy said, that Eris actually asked you guys to put the U.S. electives as work experiences. I didn't know that. Okay, my bad. I'm sorry. So directed from Eris. And Tommy?
Yeah.
Also, there's a question about Laura's delay between appearing on Oasis and...
Yeah, it takes a while. What happens is every lore that we upload It takes a while until Eris actually looks over the law and sees it's for the exact student and it's the exact letter writer. So it can take up to 3 days to a week, even sometimes more, if they have a lot of volume of lawyers going through their system until you see it.
Okay, great. And back to the topic of work experiences for the U.S. electives, should we be including future electives on that as well, or should we only be including the ones we've already completed or are in progress, etc.?
Well, I think we are already, somebody asked that, and usually what you put in as a work experience or as a clinical, something that you put on is something you already did or you're doing now. Because what can actually happen is you list something and then you end up not doing that rotation and it may not look very good in the long run. So just list anything that you already have done or you're doing right now.
Okay, one other question is that there was a question about the NRMP ID. I think we're not, able to sign up for NRMP yet, so there's a spot for that in ERAS. What should we be doing with that?
I would actually, for that, contact the help desk and ask them.
Okay, guys, anyone else out there in TV land that has questions?
Okay, there was one last question. It was partially answered, but I think we should direct it further. There was a question about undergraduate research, if there is a reason why that should be included. Obviously publications, but if a person should be specifically excluding any time they spend in undergraduate labs, etc.
I mean, if it's on the research experience, I think you can state it briefly, but I wouldn't make a big deal out of it. I mean, it's happened a long time ago. I wouldn't make a big deal out of it. I would just, one liner like we talked about some of the people that sent CVs and been edited.
Okay, I think that answers the questions that we had submitted on our Google Sheet. Thank you, Dr. Allen.
Okay.
No question. We received an email from the school about putting our rotation under work experience.
Yeah, we just talked about that. Work experiences. Anything else in the forum?
Let me see.
We're just checking to see if anybody else is sending questions.
These laws, we should use 2 from Israel and 2 from the States.
As far as letters of recommendation, again, we've talked about that. If you have 2 from the States, then use those, and plus 2 from Israel. If you have 3 from the States, even better. You just have to make each person with their own letters of recommendation. Some people have research letters, so it has to be kind of a equation for each person individually.
Did you say that U.S. electives are not supported, are not supposed to go in the work experience?
They are.
Yeah, I think we've talked about that. I'm sorry, but the Eris actually asked you guys to put the work experiences and the electives as work experiences. I didn't know that. I'm sorry.
One other question, Dr. Allen, that was posted on the forum. There was a question about whether or not our U.S. clerkship grades would be included on our Sackler transcripts. Does that occur?
We don't get that. Right, we don't have the time to get that in a timely enough fashion in order to include it on your transcripts. They have to already be already uploaded in the Sackler format, so it's already done.
So if grades were already sent in, is there a possibility that they were uploaded, or it's just absolutely?
No, it's a matter of course. We get so few grades in the right amount of time that we don't put them on the transcript. Okay, so basically, just again to reiterate in terms of timelines, the office will be here. Will be open this week, and then starting next week, everyone's off for holidays. I probably won't have email access starting on Thursday, basically, for about a week. So everyone knows what they need to do. Hopefully, has their question answered. We'll try to get all of the personal statement edited by Wednesday of this week. I hope to get them. I can't promise, but I'll do our best.
Guys, if you have any questions about how do I sign my letter of recommendation, why can't I see it, these different questions, please contact the help desk. That's what they're there for. Please make sure that if there's something that you don't clearly understand or you do not know how to do, contact them. I've spoken to Eris many times these past few weeks, they would please ask, they prefer that you ask the questions and then not have something go wrong in the last minute. So just call them, email them, contact them. If something doesn't make sense on your application, please contact them.
Just one other thing, I know you guys aren't all in super close contact, but if somebody on the group, you know, the forum or whatever it is, senses that there's somebody that needs a lot of help and is not coming forward to ask for it, sometimes a good friend can also, you know, send an email, say, listen, you know, I know so-and-so could really use a phone call. I know Dr. Capo tried to call a lot of people the last couple of weeks. We really want to keep on top of the issues that are going on with you in the fourth year. Okay, so I know this is a little bit glitchy and a little bit difficult. It's the first one we've ever had, but I think this is a good start. Okay, good luck, guys, and have a happy new year, and we'll see you.
Shana Tova.
Oh, sure.